I just want to say thank you for being able to, for being here today. And thank y'all for just the opportunity to be able to speak with you. I realize that there's an interpretation that is going on, so I'll make sure that I try to pace everything so that we can get as much as possible out of our time together today. So, for our topic today, we're going to be looking at strategies for crisis response during telehealth visits. One of the things we're noticing right now is that telehealth is the main way people are being able to connect because of COVID-19. And we want to make sure we're able to talk about this in a way that helps us to be able to work with our clients in a more positive fashion. So for today, we do have five main objectives that we want to just look at. The first one, we want to just be able to define what a crisis is. We also want to look at some things that factors that influence our responses to trauma when that happens. Also, how to plan for crisis management, to review crisis intervention models, and then finally, the design a telemental health counseling crisis protocol. Want to help us start off with a few definitions to help us to know exactly what we're talking about today. I will spend most of my time on the first definition and leave the next two for you just to be able to read. But I just want to help us to understand what a crisis is in general. Many times when we think of a crisis, we think about a serious situation where we have to make an action because something has happened, and because of that, we're going to either have some positive or negative consequence to, attached to that. And when we think about the word consequences, sometimes there's a negative uh, connection with that word, but the reality is all consequences mean is that because something has happened, either we're going to respond to it in a way that's going to be helpful to us, or we're going to respond to it in a way where it could be harmful to us. And so we want to look at really look at crisis from that perspective, that we have an opportunity for positive things to come from it, or an opportunity for negative things to come from a crisis that happens. Also, when we think about crisis counseling, that's just from a basic definition for this would be it's just a process that we'll go through to help a person who is dealing with crisis, but this is more of a long-term perspective versus a short-term perspective. And finally, we'll look at crisis intervention, and these are just steps that we take to deal with the crisis when it's right there in our face, but these are usually more short-term types of interventions. All right, when we begin to look at the purpose of crisis counseling, there are some main things we want to note. And I got five main things here that we want to be looking at. And I just want to highlight to me a couple of the major ones we want to be considering. If you notice for number one, it talks about normalizing feelings and normalizing people's reaction. When we think of normalizing feelings, the basically purpose we're trying to get across here is that we want individuals to be able to know that the things that they're feeling inside their body, what they're feeling emotionally, those are things that are normal, and it's okay for them to feel those things. This becomes important because whenever we are dealing with a crisis, we want to know that we want to get them back to a place of stability as soon as possible. But in order for that to happen, I need to be able to help them to understand and realize that what they're feeling is okay and it's okay to feel a certain way. And then you look at the other three points in the middle, it gives you some other things we're looking to do. But what the long term goal is to prevent future mental health issues. That is our long term goal. Is that by going through these 5 steps, we want to make sure that individuals have the ability to prevent any type of mental health issues that may occur in the future, because we want to be future oriented, dealing with what's going on right now, but also helping them in the future as well. All right. So when we begin to look at crisis characteristics, there are a few things we want to make sure we look at when we look at a crisis. The first thing is that every crisis is complicated. The reason why we say that every crisis is complicated is because everyone is going to look at crisis from a different perspective. You may find yourself in a situation where you have two people who go through the exact same situation, but they're going to end up dealing with it in a different way. And so every crisis is going to look different for each individual that is out there. We also look at when on the fourth point where it says crisis is universal, because a crisis is something that can happen to anyone at any time. And so, because of that, we realize that we all have an opportunity in our life where we have to deal with crisis at one point or another. And also, that crisis is time limited, which means there's a certain time period we can expect to be dealing with crisis. And so, because of that, crisis does have a hopefully a short term time period that we're dealing with, and it's not something we're dealing with for a long time. So, when we are dealing with personal crisis, there are some different ways in which we react to that crisis. For some individuals, they're able to grow stronger because of the crisis, and this makes them a stronger person at the end from dealing with the crisis. Some people find themselves in survival mode where they block it for a temporary time period, but this does end up leading to future problems for them. And then others we see will end up breaking down from the crisis because they have to put their life on hold, basically, just so they can deal with the immediate situation they're under. So on this slide, we're talking about some factors that happen either before trauma happens or after trauma happens, and how it ends up affecting the individual. One thing we see is what we call pre-trauma factors, and these are because of these factors, these can make the trauma a little bit more complicated to deal with. One of the first ones, or the main one I want to talk about, is just those multiple traumatic experiences. That if someone has had multiple traumas in their life, dealing with crisis can be more difficult because they've had crisis after crisis happen in their life. Another thing we want to consider is the low socioeconomic status, and I'll explain that a little bit deeper here. With the low SES, I'm not saying that there's anything wrong with individuals who fall into that category. What I'm saying is that individuals who fall into that category have a propensity to see things that over and over again that puts them in a situation where it's harder for them to be able to get the help they need because they may not have the funds available to be able to deal with the crisis because of the socioeconomic stat class that they find themselves in. So this is not a judgment of someone who falls into that category. It's just a reality that they have to live through. As we look at post-trauma factors, there's two main ones I want to talk about. One is just the opportunity to share their story. One thing I've noticed is that when individuals have an opportunity to talk about what's going in their life, it helps them to be able to deal with it a lot better because they actually have someone who's willing to listen to them and listen to the things that's happened with them. And so storytelling is a big part of many cultures. And so because of that, it's important to give opportunity for individuals to be able to share their story. Another post-trauma factor we want to consider is just that sense of closure. It becomes very important for us to have the ability to feel like we have been able to close a chapter on the situation that we are in. For many individuals, it can be difficult for that sense of closure to happen, but that's something that we definitely want to work towards. That way, they have the ability to feel like they're able to move on. And so, as we see from the slide, there are several pre-trauma factors we need to consider and several post-trauma factors we must consider if we want to help someone during the midst of a crisis that they have. Now let's talk about some of the long-term effects that could happen with someone when they don't are not able to deal with a crisis or trauma in the right way. One of the main things I see individuals deal with the most is what we call free-floating anxiety. With this free-floating anxiety, we're basically saying that they are feeling anxiety in just about every situation they find themselves in, and this can cause stress for them in their body, stress for them in their relationships, stress for them in just any environment they find themselves in. Another one is just diminished capacity for problem solving. And what we see here is that individuals feel so overwhelmed because so many things are going on in their life that when it comes to dealing with small issues that usually don't take that much thinking or much effort to do, it becomes difficult to do that because they're feeling overwhelmed. So this slide helps us to see that if crises are not dealt with in the right manner, there are many different factors or effects it can have on us in our individual lives. And we realize that just because when it affects us on the individual level, it's also going to affect all those people who are around us. Next, we want to talk a little bit about planning for crisis management. The main takeaway I want you from this slide is for us to look at how do we go about establishing goals for the people we work with, knowing the right type of questions to ask our clients whenever they are struggling in a crisis. And then we want to be able to create a crisis response plan with some very specific steps that will lead them towards health. All right. Next, we want to talk about crisis intervention models. There's three main ones we want to look at here. The first one is called equilibrium, and this is where we are able to bring back stability to where we used to be before the crisis happened. The second is cognition, and this is where we look at some of the faulty thinking the individual has and help them to be able to work through that thought process so they are thinking about things from the right perspective. And then there's a psychosocial transition. And this is where the client may have a need for some internal or social change in their own life in order for them to have some great coping mechanisms to deal with the crisis that they're in. When we consider the FEMA crisis model, they have six main points that they bring out, and I want to cover two or three that I feel like are the most relevant to our topic today. One of the first things it talks about, it helps people to understand what they are experiencing. It's important for us as we are helping people who are going through some type of crisis that they know what's going on. There can be things going on inside their body that they're not used to feeling. There may be emotions they're not used to feeling, and so we want to help people to understand what is this that I'm feeling and how do I deal with the experiences that are going on with me right now. Another thing is being able to validate and affirm people's reactions. One thing I've learned from counseling from all these many years is that the main part of helping people to get through whatever they're feeling is for them to be able to walk away with a sense of validation that the feelings that they have, that it's okay to have those feelings, but that someone else recognizes that those feelings are they're going through are significant and those feelings are important. And also just being able to offer some practical assistance to the person who's in crisis. If you think back to Maslow's hierarchy of needs, we notice that on the bottom we have to get the basic needs met for an individual before we can help them get to the higher level needs in their life. So as we are considering this counseling model, we want to make sure that people's basic needs are met before we can get to some of the deeper things that they are dealing with or struggling with. Here we want to talk about the six-step model of crisis intervention. And there's two main points I want to make here. First is just simply listening to what the client is going through. It's important for us to realize that when someone is struggling with something, they need to have someone who is willing to listen to everything that's going on with them, even though the person who's listening may not understand the relevance of the things that of the person is going through. And when you're able to do that for them, it helps to define the problem for the client. It helps to ensure safety, a client safety, and also provide support for the client when you do great listening. Also, with the acting aspect of this, whenever we are uh, going through this crisis intervention with them, we want to give them some specific things for them to work on. That way, they have a place to be able to go once they are working with us. So we set goals with them. So part of that is we look at the choices that people have as they're going through crisis. We want them to help make plans for them as they begin to grow. And also, we want to obtain commitment to those plans because if we're going to be working with them and there's plans for them, we want to make sure they're actually committed to that process of getting better. All right. So when we look at assessment ABC, there's three main things we are looking at. We want to be looking at the person's affect, making sure that their affect is not impaired. And because if it is impaired, then we do some work that we need to be able to do that. We also want to look at some specific behaviors that they are doing. And if they're doing behaviors that are causing more harm than good in their life, we want to work through looking at those behaviors they have to help them step to a different place. And then we want to look at the cognitive state. And we want to see, has this crisis made their life worse by them now having faulty beliefs? So affect, behavior, and cognitive state, those are three main things we want to focus on as we are trying to assess our clients as they're going through a crisis. So as we begin to take action, I want to highlight about 3 or 4 things on the screen here. One thing is important for us is that we are always able to see individual differences. One thing that can cause more damage than good in any situation is that we make assumptions about individuals based on their outside appearance, and that's never a good thing. We want to make sure that we see that person as an individual and treat them as an individual so that they can get the right type of help that they need. Also, we want to acknowledge client safety. We want to make sure that our clients feel safe and they have some safe outlets to be able to talk about what's going on in their life. And we also want to use client coping strengths. And what I mean by this is that we want to make sure they have some coping skills that will help them to maneuver through the crisis they are going through. These coping skills could be things such as breathing, mindfulness, or just anything that's going to help bring that person to a place of calm. And so this slide gives us a very good overview of some things we can do to take action as we see our clients are going through that crisis. Next, we want to talk about the counselor's role. We've talked about already about listening to their concerns, so listening becomes an important factor. Also, we want to deal with the current client functioning, and we want to be able to know what all can they handle in this moment in time while they're in this crisis. And also talk about speaking clearly and in the present about the problem. The more we can stay in the moment with the client in the midst of that crisis, the easier it's going to be the easier it will be for them to be able to process it because we're talking about the here and now and what they're experiencing because of that crisis in this exact moment. Surviving and moving on. The two main things I want to look at on this slide is that we want our clients to be aware of what they are feeling. Sometimes that feeling could be anger, it could be sadness, it can be a feeling of loss, It can be a lot of different things. So because of that, we want to help our clients to be aware of those feelings. And then as the next point says, we want them to be able to externalize those emotions. And as we consider externalizing the emotions, what we're basically saying is we want them to get those emotions from inside their body to the outside their bodies. That means we're getting them to talk about the things that they are feeling in that moment in time. And I believe when we are effective in helping our clients to be aware of their feelings and effective in externalizing their emotions, then we can start this process of healing for them that they are trying to get to. So now we want to transition specifically looking at telemental health crisis. So far, we've talked about crisis in general, but now we want to specifically look at how does this work in an online environment. One of the first things we want to do is to prepare for a crisis before the crisis occurs. It is always easier to deal with a problem if we have some set guidelines before a person finds himself in that situation. So to help out with that, we want to make sure we have some type of crisis protocol, which we'll speak about in a minute. We want to know the state laws and what we're mandated to do, what we're mandated to report. And most importantly, we want to know our client's location for each session, their physical location. So I'm going to combine two of the points on this slide because they hit some of the same points. If your client is expressing any type of suicidal or homicidal ideation, then we want to make sure we assess for any intention they may have, any plans they have, or any behaviors that could lead to them hurting themselves or hurting someone else. Also, if a client is reporting any type of abuse to a child or disabled person or an elderly person, then we need to follow our state laws when it comes to that. And it's important for us to realize our state laws are going to look different everywhere. So something that happens in New York will look different than it does in Arkansas. So you want to make sure you know exactly what your state laws are saying. That way you know how to respond appropriately. So as I just mentioned, we talked about knowing the laws in the state that you're in physically, and also the laws of the state where your client is physically at the time of at the time of the appointment. That's really important to know that. Also knowing what your state law has to say about emergency hospitalization, because every state looks different when it comes to being able to hospitalize someone against their own will. So we need to know what that looks like for each state. As a part of your informed consent, you want to make sure that you have some type of crisis hotline that someone can call and talk to when you're not available to be able to meet with them. So for me, I will use the National Crisis Hotline because that works well for me. But there may be something local to your area that works just as well. Also, sometimes a crisis can happen during the middle of the session, and so it may be a thing where you need to, since you know where your client's location is, you may have to send help out to where your client is to make sure they are assisted if they're being assisted during the middle of that crisis. And sometimes a crisis can occur and you may have a disconnection with your client in the middle of that. And so in those type of cases, you want to go ahead and move forward with your crisis plan, even though your client may have lost connection with you. And this is why it's important for us to make sure that we know where our client is at every session, where their location is at every session. That way we can know how to send help to them if they need it. When considering your intake procedures, there are a few things you want to make sure that you have for your client. One, you want to have a definite contact person, emergency contact person for them, and saved so that you can know somebody to contact if you cannot get connected with your client. Two, you want to make sure you have access to local first responders so that you can get help to your client as soon as you possibly can. Three, you want to frequently make sure you're updating the client's address. And so if you're noticing through telemental health that their background has changed or it doesn't look the same as it always has, you want to be careful to make sure that you know that if they're in the same location for every session. And this will help you to be able to provide good services for your client, and it also helps to make sure that they stay safe in the midst of this crisis due to the use of telemental health. Now, after the crisis has occurred, we want to do some assessment of our client. One of the first things we want to see is are they still appropriate for telemental health counseling? If they have attempted to harm themselves on multiple occasions, then it may be a sign for you that online therapy may not be the best way for them to be connecting with a therapist. Also, if they have connected with or admitted to a hospital, we want to make sure we get a release information for the hospital so we can be up to date on the client's mental health status. And if we continue to use online counseling with the therapy with the client, then we want to make sure we have some good supports out there, knowing who their medical doctor is, who their psychiatrist is. That way, we're ensuring that we have a good team of people to work with the client. So to review some of the things we've talked about so far today, number one, we just want to make sure we always stay prepared for crisis because crisis can come at any time. And part of that being prepared is to make sure we know our laws in our state and also in the state where our client resides so that we can give them the proper resources to make sure that they stay safe and we be successful with the work we're doing with them. Also, in your informed consent, you want to make sure you have your crisis protocol listed out so the client knows exactly what can happen if they go into crisis, especially in an online environment. This helps your client to know that you are looking out for their future health. And because of that, they know that if you need to take certain steps that they may not necessarily agree with, they know from the beginning of your relationship together that this is the steps that you need to take to ensure their safety. Also, we want to make sure we collect client contact information and emergency contacts once again before that crisis happens. That way, we are prepared. And then we want to follow our protocol whenever it's necessary. And the reason why we want to do this helps us see, can we continue this online relationship with the client?